So when is lower lumbar back pain serious? I'm Anthony Ghosh, I'm a consultant spinal neurosurgeon and founder of the Spine MDT. And if you watch this video, I'm going to explain the causes and what to look out for. Well, firstly, what I mean by serious is something that's putting your life at risk or the nerves or your spinal cord at risk, therefore you losing your ability to walk and move your legs. But the good news is that this kind of stuff is actually quite rare, and the severity of your back pain, how debilitating it is, doesn't necessarily correlate with how serious the cause might be. Let's quickly look at some patterns of back pain so we can try and determine at least whereabouts it's coming from. So a sharp stabbing pain that comes on fairly suddenly in the middle of the back, that sometimes can spread across the back, is usually caused by a tear in the lining of the disc, what we call an annular tear, but also a strain or a tear in the muscle of the back can give the same picture. Pain in the lower back that radiates down to the buttock or the glute region, or even sometimes to the mid-thigh, can usually be coming from wear and tear and referred pain from a facet joint, one of the joints at the back of the spine, or even the sacroiliac joint where your spine meets or joins with the pelvis. It's often worse when you lean back and extend the spine rather than lean forwards. Then we have pain in the back that radiates right the way down the leg. It can be associated with numbness or tingling, and that's usually a trapped nerve. That could be from a slipped disc, a disc herniation causing nerve root impingement, or lumbar canal stenosis, narrowing of the central canal of the spine, where all of the nerves get trapped, and that can actually give pain in both legs. Whilst all these patterns of pain can give you quite severe pain and come on really acutely, they are not necessarily dangerous. Most of the time they do actually settle down within a few days to a few weeks. So if I see a patient with any of these patterns of pain that's come on fairly recently, I'll usually get them to work with an osteopath or a physiotherapist in my network under my oversight to start with. With the right plan agreed between me, the osteopath, the physiotherapist, and the patient, the majority of patients will improve without the need for any invasive intervention, such as surgery or an injection. Serious causes include fractures of the spine, cancers that start from or end up in the spine, infections of the spine, and large disc herniations that cause a syndrome called cauda equina syndrome, where all of the nerves that run down to the legs and the sphincters of your bladder and your bowel are compressed. If you have quite significant back pain that has come on immediately or soon after an accident with high impact, such as a road traffic accident or a fall from a height, for example, with or without pain or problems with your legs, that could be a sign of a fracture. For this, you need to be assessed immediately to help prevent damage to any of the neurological structures, such as the spinal cord or the lumbar nerves, to prevent paralysis or loss of neurological function of your lower limbs. If the pain has come on after quite a trivial accident, like a little fall to the ground from standing, for example, but you have a background of osteopenia or osteoporosis, where the bones in your body become slightly brittle, then they're a little bit more prone to fractures from more trivial injuries. So again, it's a similar pattern of pain, and that does need to be investigated, as well as the underlying cause, the osteoporosis or the osteopenia. In these scenarios, whilst sometimes we do recommend invasive treatment to stabilize the spine, as you would with any other fracture, often the chances of neurological injury from this is actually quite rare, and a lot of these fractures can be managed without surgery. If you have a history of cancer and you've started to develop back pain, possibly worse at night when you're lying in bed, or when you press over a very specific region of the back, it really triggers the pain. Or indeed, if you started to develop some weakness in the legs, we have to be suspicious of the cancer spreading to the spine. Again, with that kind of pattern of pain, if you don't have a history of cancer, but perhaps you've got other symptoms of potential cancer, such as unexplained weight loss in the last few weeks or months, that's something you need to get checked out as well. If the pain in your back is also associated with a fever, sweating, or possibly come on after A recent infection, such as a urine infection, for example, is an obviously infection within the spine or the discs in the spine, is something that we have to be suspicious of. It's often worse when weight bearing and just progressively gets worse with time until treated. This is something that needs to be investigated and treated with prolonged antibiotic therapy, sometimes surgery, depending on the spread of the infection. Now, if you have pain radiating down both or one of the legs even, but with some numbness in the genitals in your private areas, or it's associated with incontinence of urine or feces, or difficulty passing urine, or even a weakness in the legs, that's an emergency that needs to be investigated immediately. That can actually be caused by compression of the nerves from any of the previous causes that I've just described, but commonly it's caused by a large disc herniation, not the typical disc herniations we talk about that cause sciatica, but a large enough herniation of disc to compress all of the nerves that run through that spinal canal that go down to your legs, the sphincters of your bladder and your bowel. If you found this video helpful, please click like and subscribe to the channel, and thank you for watching.